Welcome to the MamasteFit YouTube channel. In this video, I'm going to break down 3 ways that you can do myofascial release to release tension within your pelvic floor. In this video, I'm going to break down 3 different ways that you can use massage techniques and trigger point releases to help release tension within your pelvic floor. My name is Gina. I'm a perinatal fitness trainer and birth doula and mom of 4. And these are techniques that I have personally used during my own pregnancies and postpartum, and that I recommend my clients do as well. There's a lot of benefit to doing a lot of different types of pelvic floor exercises and stretches to release tension within our pelvic floor, but sometimes it can be really helpful to just do some trigger point and myofascial release to release some of that tension that we may be holding on to. There's a few different tools that we can utilize to target our pelvic floor externally and internally. The first 2 tools are going to be external tools that we can utilize. We can use a yoga tune-up ball or a lacrosse ball. So it's a soft ball that we can press into the glutes and into the pelvic floor externally. And we can use a foam roller to sit down onto as well. Let's start with the foam roller. So with the foam roller, you can just sit directly onto it, either with your legs bent or your legs straight. Your legs straight are going to put a little bit more pressure into the perineal area. So if you want a little bit less, just bring the feet up. This can also help put you into a deep squat position, which can also help to stretch different portions of your pelvic floor. From here, you can either rock back and forth onto the foam roller, so just applying direct pressure to the perineal area, or we can rock a little bit side to side by bringing one knee back and the other knee forward, and then switching to the other side. The forward and backwards movement, it will apply more pressure to the front half and to the posterior portion of your pelvic floor, while that side-to-side motion is going to direct more of that diagonal tension within your pelvic floor. When you feel a point that feels more sticky, we can pause there and breathe into it. So we're going to think inhale to kind of push your pelvic floor into the foam roller, and then exhale, just release and to let go. So big inhale, and then exhale, let go. Now, the foam roller is going to cover more surface area, so there's going to be less pressure directly onto your pelvic floor and perineum. So this can be a great option if you need a little bit less pressure to be applied. But if you want more direct pressure, we can use that yoga tune-up ball or a lacrosse ball to sit down onto. With the yoga tune-up ball, we're going to place it in between the sits bone and that tailbone in this little gap right here. We've got a lot of ligaments that are attaching from our pelvis to our sacrum, and then also a lot of musculature that sits in this back space. And for a lot of us, we tend to hold a lot of tension back here. So you'll take your ball, you'll place it in that little gap, sit down, and we'll roll around on it. So you'll take your ball, you'll find your sits bone, you'll find your tailbone, and we're going to place it right in that little pocket right there, and then we can sit down on it. Now you can have both feet up so that we can use both feet to help you slide. You can have one leg straight out. It really just depends on what feels most comfortable for you. And then when you hit a point that feels a little bit more sticky, or maybe it's a little bit more uncomfortable, we can pause there and breathe. So we can think big inhale, exhale, release. And then every inhale, we're thinking push the pelvic floor into the ball, and then exhale, just let go. And then once you find that sticky spot, we can also add in a little bit of opening the knee, closing the knee, maybe straighten and bend the leg, so we can move the hip through some different positions to see if that helps to release some of that tension. And then we can use a pelvic wand. This is from Intimate Rose to do internal releases within the pelvic floor as well. This was something that was incredibly helpful for me during my last pregnancy when I was having more SI joint pain and a little bit more pelvic floor tension to the back part of my pelvis. With a pelvic wand, you'll find a comfortable position. Sometimes I like to do it in the bath, but you can also do it standing in the shower or laying in your bed. If you need to, you apply lubricant to the pelvic wand, and then you can insert it into your vagina. And then for me, a lot of the tension was more towards the back part of my pelvic floor. So I would direct the wand back. So if you think about your pelvic floor like a clock, with noon being to the front, 6 being towards the back, we're kind of going to like a 7 or 8 o'clock. From there, when you insert the wand, you're going to just kind of rub it inside that pelvic floor until you find a trigger point. And at that point, you'll pause and you'll breathe into it, similar to the other 2 movements. I'm going to think big inhale into the pelvic wand. And then exhale, just release and let go. And then maybe we slide it a little bit more. With the pelvic wand, we typically want to avoid going directly to the front and then directly to the back, just because it can be a little bit more irritating if we apply a lot of pressure onto the rectum or a lot of pressure onto the urethra. So again, if you think about your pelvic floor like a clock, we're probably 1 o'clock to 5 o'clock and then 7 o'clock to 11 o'clock with the pressure that we're applying. In addition to all of the stretches that you can be doing to release tension within your pelvic floor to help it move better and function better, we can also do some myofascial release techniques to help release tension within our pelvic floor. We can use some external techniques with the foam roller or the yoga tune-up ball. The foam roller will have more surface area, while the yoga tune-up ball will be a little bit more direct pressure. When we feel places of tension, we're going to breathe and press our pelvic floor into the structure and then exhale to let go. And then we can use a pelvic wand to insert into the vagina to apply direct pressure internally to the pelvic floor. And similarly, when we find a pressure point, we're going to breathe into the pelvic floor and then exhale to release and let go. When using the pelvic wand, we want to stick to about the 1 to 5 o'clock and then the 7 to 11 o'clock if we think about our pelvic floor like a clock. I hope that these strategies are helpful for you to find more release within your pelvic floor. Some of the pelvic floor symptoms that you may be experiencing may be due to pelvic floor tension as opposed to there being a functional problem with your pelvic floor. So when we can release the tension, usually we find a relief in our symptoms as well. If you want more support for your pelvic floor during your pregnancy or your postpartum, check out our online fitness programs that are designed specifically for this phase of life. Our prenatal fitness programs are designed to help support you to stay strong and pain-free throughout the entirety of your pregnancy, because pain is not a requirement of pregnancy, while also helping you to prepare for birth with pelvic opening exercises to help support your baby's position, and exercises to help release tension within your pelvic floor. Our postpartum programs are designed to help support recovery from pregnancy and birth by rebuilding and reconnecting with your pelvic floor and your deep core musculature, and then bridging that gap from rehab to your return to fitness so you can run faster, lift heavier, and live a full and active life with your kids. You can check out all of our fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings, and we would be so honored to support you on your journey. And then be sure to subscribe to our channel if you want more videos like this to help you connect better with your pelvic floor so that you can move more comfortably during pregnancy and beyond.